Well, one of the benefits of living in our state is the access that we have to amazing state-of-the-art technology when it comes to healthcare. Dr. William Regine is the professor of radiation oncology at the University of Maryland School of Medicine, Maryland Proton Treatment Center. It is a very long name. I appreciate you being with us.
Glad to be here. Thanks for having me.
It's really interesting information that you're providing about proton therapy. Tell us a little bit more about it.
So protons is a more advanced form of radiation therapy. And really the difference between proton therapy and standard radiation therapy is that protons, when they're delivered into the body, you can direct it to right at the tumor, and there's no additional radiation sent beyond that spot, which means compared to standard therapy, there's a dramatic reduction in exposure to surrounding critical organs. So imagine brain tumors, tumors in the back of the throat, lung cancers, breast cancers, where you have heart and lung, prostate cancer, where the bladder and the rectum is. The proton therapy will dramatically reduce dose to those surrounding normal tissues.
And so you can really target and pinpoint. So what are the types of cancers that can be treated with this proton therapy then?
Most commonly what we call solid tumors, or tumors that are in the body and near anything critical. So the most common tumors we're treating nowadays are brain tumors, throat cancers, which we see a lot more now because of the rise in HPV, breast cancers, lung cancers, esophageal cancers and prostate cancers are among the most common that we treat now. And especially people who are getting chemotherapy for their cancers, because chemo really enhances the reactions from standard radiation therapy, and protons can reduce those reactions in patients getting chemotherapy.
So how is this therapy then different from the conventional radiation therapy? Is it just that it's targeted?
Well, they're both targeted, but standard radiation is delivered by what we call photons, P-H-O-T-O-N-S. And photons essentially are high energy X-rays, and they travel to the tumor, but they continue to travel into the body and past the tumor, which means if there's an organ there, that's going to get exposed. Protons are charged particles, which the patients don't feel, but because they're charged particle, when they get into the patient, you can pick an energy of proton so that when it arrives to the tumor, it delivers all of its dose, and there is no additional dose that goes beyond it. So it's a dramatic reduction in the exposure to a surrounding normal organ or normal tissue.
It really is fascinating how that is, how that's even possible. Of course, people are going to want to know the risks, the benefits, the potential side effects, all of it. What are they?
So the risks of proton therapy compared to standard radiation therapy are similar in that in the area of the tumor, we're going to get a reaction that hopefully for the most part is associated with killing the tumor, but the normal tissue that's around the tumor, whether it be the lung, the esophagus, or the throat, will also get some reaction, right? But the big difference is that area of reaction is going to be dramatically smaller and lesser compared to somebody who's getting photon or standard radiation, because that dose is being spilled in a much broader area around the tumor.
So I know that you are, in addition to being a doctor, also a professor. What sets the Maryland Proton Treatment Center apart from other proton treatment centers in our region?
Yeah, great question. So first of all, we're the only proton center in the state of Maryland.
Well, that'll do it.
Yeah, second of all, this is very complex therapy. So the other two big things that set us apart is we've been open since 2016, and our experience is second to none. We've treated over 2,600 patients, and our physicians, who are all School of Medicine physicians here, are not only experts in proton therapy, given that long experience, but they're also tumor-specific experts. So you'll come see us, and if you have prostate cancer, you'll see somebody who essentially just takes care of prostate cancer. If you have a breast cancer, you'll meet someone who just takes care of breast cancer. The other big difference, we're only one of maybe 2 or 3 places in the entire country. The cost of proton therapy here is essentially equivalent or similar to standard radiation therapy. most other centers, the cost of proton therapy is dramatically more. It can be 2 to 3 times more than standard radiation. So in most centers, insurances may often not cover that proton therapy. Here, we have a 90% coverage rate with insurance. That's a common question patients ask, will my insurance cover it? And we're fortunate here that 90% of patients have their proton therapy covered by insurance.
This is great news for us living here in this state, just to be able to have a wonderful technology like this and these advancements in medicine right here in our own backyard. To get more information, I'm told we should just go to askforprotons.com, correct?
Exactly. Askforprotons.com or 86MD Proton is a phone number you can call, and you'll actually get to a physician if need be.
All right, Dr. Regine, thank you so much for being with us. Really appreciate that insightful information, and we'll be right back with more Midday Maryland right after this. Stay tuned.
Thanks for having me.